Welcome to Next General Guides. If you're a student and need help in studying for exams, you're in the right place. So, you're gearing up for the IC&RC Alcohol and Drug Counselor exam, and reading the material isn't enough. I will help you prepare with 20 practice questions that have been designed to mimic the style and cover key domains you may encounter on the ADC exam. We'll go through each question. I'll give you a moment to think, and then we'll break down the correct answer and explain why it's the correct answer. So, grab a notebook, get comfortable, and let's dive into these questions. Number 1. A well-constructed treatment plan should be A. Static and unchangeable. B. Developed solely by the counselor. C. Client-centered, measurable, and flexible. Or D. Focused only on abstinence. The correct answer is C. Client-centered, measurable, and flexible. A well-constructed treatment plan is designed to meet the unique needs of the individual, meaning it adapts as their situation changes and includes specific, quantifiable goals. It's not a rigid document, nor is it created in isolation by the counselor. While abstinence might be a goal, the plan isn't only focused on that. It addresses broader aspects of recovery. Question 2. What does the S in SMART goals stand for in treatment planning? A. Simple. B. Specific. C. Sustainable. D. Significant. The correct answer here is B. Specific. In the SMART goal framework, specific means clearly defining what you want to achieve, leaving no room for ambiguity. This helps make goals clear and actionable. Question 3. A client's treatment plan includes the goal. Client will attend 3 AA meetings per week for the next month. This is an example of what type of goal? A. Long-term goal. B. Short-term objective. C. Unrealistic goal. D. Process goal. This is an example of a B. Short-term objective. It's a specific, measurable action planned for a defined, shorter period, the next month, that contributes to a broader, long-term recovery goal. It's a concrete step, making it an objective. Question 4. Collaboration with other professionals, e.g., physicians, psychiatrists, social workers, is essential in substance use disorder treatment primarily because A. It reduces the counselor's workload. B. It ensures a holistic approach to client care. C. It is a legal requirement for all clients. D. It allows for sharing of confidential information without consent. The best answer is B. It ensures a holistic approach to client care. Substance use disorder often co-occurs with other medical, mental health, or social issues. Collaborating with various professionals allows for comprehensive support that addresses all facets of a client's well-being, leading to more effective and sustainable recovery. Question 5. When referring a client to a higher level of care, what is the counselor's ethical responsibility regarding client confidentiality? A. To share all client information with the receiving facility. B. To obtain the client's informed consent before sharing any information. C. To only share information verbally. D. To withhold all information until the client is admitted. The correct answer is B. To obtain the client's informed consent before sharing any information. Ethical guidelines and legal requirements, like HIPAA, mandate that a client must give explicit permission before their confidential information can be shared with other providers or facilities, even for referral purposes. Question 6. A client requires medical detoxification services. To whom would the counselor most appropriately refer this client? Is it A. A peer support specialist? B. A psychiatrist? C. A medical doctor or specialized detox facility? Or D. A family therapist? The appropriate referral is C. A medical doctor or specialized detox facility. Medical detoxification involves managing withdrawal symptoms, which can be dangerous and require professional medical supervision. Only a medical doctor or a specialized facility equipped for detox can safely provide this level of care. Question 7. What is a continuum of care in substance use disorder treatment? A. A single, standardized treatment program for all clients. B. A range of services from least intensive to most intensive, tailored to individual needs. C. A system where clients remain in the same program indefinitely. Or D. A network of counselors who share clients. A continuum of care is B. A range of services from least intensive to most intensive, tailored to individual needs. It recognizes that recovery is not a one-size-fits-all journey. Clients can move between different levels of care, from outpatient to residential, for example, based on their evolving needs, ensuring they always receive the most appropriate and effective support. Question 8. Which of the following is a key principle of effective treatment planning? A. Counselor-driven decision-making. B. Client participation and ownership. C. Focus on past mistakes. D. Ignoring co-occurring mental health issues. The key principle is B. Client participation and ownership. For treatment to be truly effective, the client must be an active participant in setting their goals and making decisions about their recovery. This fosters motivation, responsibility, and a sense of ownership over their journey. Question 9. A client expresses a desire to find employment. What type of referral would be most appropriate? Would it be A. A support group, B. Vocational rehabilitation services, C. A mental health therapist, or D. A legal aid service? The most appropriate referral would be B. Vocational rehabilitation services. These services specialize in helping individuals develop job skills, search for employment, prepare for interviews, and overcome barriers to employment, which directly aligns with the client's expressed desire. Question 10. The primary purpose of a release of information form is to? Options are A. Document the client's progress in treatment. B. Obtain client consent to share confidential information with specific parties. C. Inform the client of their rights. Or D. Authorize billing for services. The correct answer is B. Obtain client to share confidential information with specific parties. A release of information form is crucial for obtaining explicit consent from the client before any confidential information is shared with third parties, ensuring their privacy and autonomy. Question 11. When developing a treatment plan for a client with a co-occurring mental health disorder, what approach is generally recommended? Options are A. Treat the substance use disorder first, then the mental health disorder. B. Treat the mental health disorder first, then the substance use disorder. C. Integrate treatment for both disorders simultaneously. Or D. Refer the client to separate providers for each disorder. The correct answer is C. Integrated treatment addresses both disorders concurrently, recognizing their interconnectedness and improving overall outcomes for clients with co-occurring conditions. Question 12. A client has completed a residential treatment program and is transitioning back to their community. What type of support would be crucial for their continued recovery? Options are A. Intensive inpatient care. B. Aftercare planning and outpatient services. C. Immediate return to previous social circles. Or D. Isolation from all previous contacts. The correct answer is B. Aftercare planning and outpatient services provide ongoing support and structure, which are vital for maintaining sobriety and integrating recovery into daily life after a more intensive program. Question 13. What is the role of a case manager in substance use disorder treatment? A. To provide direct counseling services. B. To coordinate services and advocate for the client's needs. C. To diagnose mental health disorders. Or D. To prescribe medication. The correct answer is B. Case managers help clients navigate complex systems, connect them with necessary resources, housing, employment, medical, and advocate on their behalf to ensure their needs are met for comprehensive recovery. Question 14. A client is struggling with housing instability, which is impacting their ability to engage in treatment. What collaborative action might the counselor take? A. Ignore the issue as it's outside the scope of substance use treatment. B. Refer the client to a housing assistance program or social worker. C. Advise the client to find a job immediately. Or D. Blame the client for their housing situation. The correct answer is B. Addressing basic needs like housing is crucial for a client's stability and ability to focus on treatment. Referring to specialists ensures they receive appropriate support for these interconnected issues. Question 15. Which document formally outlines the client's goals, objectives, and interventions for their treatment? A. Intake form. B. Progress note. C. Treatment plan. Or D. Discharge summary. The correct answer is C. The treatment plan is the core document that details the client's personalized path to recovery, including their specific goals, measurable objectives, and the interventions the counselor will use to help achieve them. How did you do on this practice test? Let us know in the comments below. If you found this helpful, please like this video, Subscribe to Next General Guides for more AI-powered study materials, and hit the notification bell so you don't miss our next video. Keep studying smart, and we'll see you next time.